Hello everybody, my name is Cameron. Thanks for tuning in on this very short video. I'm just going to give you a brief summary of how these Aflac plans work. Uh, and these slides that you're about to see don't cover everything, so please go to your policy manuals for all the nitty-gritty details for exclusions and limitations. So let me describe real briefly before we get started and all the different specific plans, how Aflac works and how it's different than your other insurance and why it's so important. So if something was to happen to you or something was to happen to a member of your family, if you to get either hurt or sick, especially if it's something major, you're going to have two basic problems. The first one is you're going to have to be dealing with out-of-pocket medical expenses. They're always larger than we anticipate. Our insurance doesn't cover everything, so we all have to come up with some kind of money to pay doctors and hospitals and clinics, especially if it's something severe. The second problem could be more serious, and that is if we're not able to work because something happened to us, then we don't have a way of getting paid. So in that scenario, our health insurance kicks in, right? So if you have health insurance, that kicks in when you go to the doctor, the hospital. But the problem and the limitation of health insurance is it doesn't pay us. So Aetna or Kaiser, they don't send us any checks to pay for our bills. So that's what Aflac is for. So these plans that you're about to see pay you cash directly. So there's 4 plans that you can choose from, and all the plans function differently. They cover different scenarios, so you can pick and choose a plan or a combination of plans that best suit your needs, suit your lifestyle, but you also have the option of electing nothing. So it's completely up to you. Each one of these plans, as you can see by the summary of plans on that attachment, has a specific payroll deduction. All right, and so each one has its own specific rate. Just a couple of notes about Aflac that are really important to understand. First of all, the rates never increase. Sometimes, especially with health insurance, every year we're worried about an increase of rates. Aflac just rolls over automatically every single year without an increase of rates. Most of the plans are also deducted on a pre-tax basis, which saves you some money. Guaranteed issue only during open enrollment, and what that means is it doesn't matter what your current health condition is right now. You can still enroll, but only during this open enrollment time. You can take your Aflac with you. This is one of the very few parts of your benefit package that is portable. So if you ever retire, you move, you go on to something else, this policy is always yours. You can keep it, and even as you set up a direct bill and take it with you, the rate does not change. You still keep this discounted payroll rate. You can also get paid through direct deposit. Aflac pays usually within 4 to 6 business days, and these policies work. It doesn't matter what other type of insurance you have. It doesn't matter what type of health insurance, what it covers or what it doesn't cover. It works on top of and alongside of anything else that you have. So let's talk about the first plan. If you look at the summary of plans, it lists them in order. And this is the famous accident plan. So this plan pays you if you ever get hurt and you go get treatment, and it's a very simple plan. It pays you based on what happened. So this is just a series of medical events, and each medical event pays you, again, based on what happened. So for example, if you take a look at the first line, emergency accident treatment, you go to that ER, urgent care, chiropractor, dentist, because you bust up a tooth, anywhere where you have to get treatment because something's messed up, then this is going to pay you between 75 to 175, depending if there's x-rays or not. If you're hospitalized because of an accident, on the first day, it's going to pay you $975, and then it's going to pay you $225 per day while you're inside that room. And there's no limit to how many days it pays you. If you're in a rehabilitation unit, it's going to pay you $75 a day. The first day of intensive care, or it's going to pay you $1,200 and then $450 a day. If you need a family member for lodging, it's $150 a day. If you have like a family staying to help you out, if you're going to be traveling somewhere, it pays $150 a day. If you need an ambulance, $300, $900 if it's a medevac. Pain management, $75. Blood, plasma, platelets, $200. If you have a concussion, $350, coma, $5,000. Burns, it depends if it's a first, second, third degree burn and the size of the burn between 50 to 10,000. Dental work up to 120. Eye injuries, dislocations up to 2,000. Lacerations, it depends on the size of the laceration, anywhere between $37 to $300. Fractures, depends on which bone is fractured, 2,500 up to 2,500. Major diagnostic testing, 150. Outpatient surgery anesthesia up to $300. Facilities fee for outpatient surgery, $75. Inpatient surgery anesthesia, $750. If you need transportation to go somewhere, either by plane or car, $350 for a plane or $150 for any other kind of transportation. Appliances are wheelchairs, crutches, braces, those sorts of things. Every time you got to go for follow-up visits, different kinds of follow-up visits it pays. Like, for example, any kind of normal follow-up visit, like if you got to go get the stitches taken out, for example, they pay you $35 per visit. Physical therapy, occupational speech therapy, $35. Chiropractic alternative therapy, $10 a visit. Dismemberment, between $75,000 to $15,000. Paralysis up to $7,500, prosthetics $3,000, prosthetic repair $1,000. If you need your home or vehicle modified somehow, like a ramp or a brace in the shower, it's very common, $1,000. And it has an accidental death benefit of $50,000. Now, the last thing I'm going to mention is what everybody loves. It's called the wellness benefit. It pays $50 once a year per person if you just go to do something for the wellness of your body, physical exam, teeth cleaning, eye exams, those kinds of things. And remember, that's on a per person. So if you have, if you're going to cover family members, then it'd be $50 times however many family members you're covering. Okay, so that's the accident plan. That's the first plan that's available to you. And as you can see in the rate sheet, it depends. The deduction depends on who you're going to cover. The second plan is the hospital plan. So this plan covers accidents, illness, and maternity, not just accidents. So the first day of hospitalization, it pays $1,150. So the way to think about this is that's usually somebody's deductible. So this would be would fill that deductible. So it would put that deductible right back in your pocket. It also has other benefits. It's going to pay you $150 every single day you're inside the room, on top of the initial $1,150. $150 a day if you're ICU, $75 a day if you're in a step-down ICU. The wellness in this is limited to a mammogram benefit, $100 per year if you go get a mammogram. Now, the third plan that's available to you is the lump sum critical illness. And I hope everybody considers this plan. It's a real simple plan. One of these critical illnesses ever hits you, cancer, stroke, bone marrow transplant, heart attack, kidney failure, major human organ transplant, sudden cardiac arrest, it's going to pay 25% of your lump sum if you're in a coronary artery bypass surgery. 25% of it is non-invasive cancer, and if you get a skin cancer removed, $250. So it pays a lump sum between $5,000 to $50,000 in increments of $5,000. So you can choose a 5, 10, 15, 20. You choose what you want that lump sum to be. Now, if you look at the rate sheet, you can see how it's age banded. It's really important you understand how the rate works. If you find how old take a look at the age band and find the rate, how old you are right now, and go across and see the rate. That is your rate forever. So even as you get older and you get into that higher age bracket, it stays at the rate that you started at. Aflac rates never increase, even as you age. And remember, this is something that can be part of your portfolio for the rest of your life because it's portable. It's something that's always there, ready for you, ready to go. A couple things about the lump sum. Your dependents are covered automatically with half of your lump sum. So if you have any kids, they're included for free. So if you chose, like for example, the $30,000 lump sum, that means every child until they're the age of 26 has $15,000 lump sum. I already talked about how rates are locked in at your age bracket. If you want to include a spouse, as you look at the second box, that is the rate for your spouse. So you would have to add up the rate for yourself in the first box, and then the second box you would have to add up for your spouse. Your spouse can only get half of your lump sum. Anyone can enroll regardless of your health. Now this has a double wellness benefit. So it's going to pay you $50 once a year just for your regular checkup, and it's also going to pay $200 for your mammogram. All right, so the last plan, let's talk about short-term disability. It's completely different than the first three plans that we discussed. Short-term disability pays you if you can't work. So the first three plans, you don't have to miss any work to get any of the payments. They're just totally based on what happened, right? This one is totally based on how many days of work you miss. Now, if you live in the state of California, the state has the State Disability Fund, referred to as SDI, and it covers in the range of 55 to 60% of your income, right? This does not affect that. This is on top of SDI. So remember that. It doesn't lower SDI, it doesn't affect it at all. This is on top because most of us can't survive long just on 55% of our income. So this is designed to supplement the rest. So if you live in California, what you do is you take a look at your gross annual income, and 40% of that can be your benefit. That's all you can get. So then you would take that amount and divide it by 12, and that would be your monthly benefit. If you live in Arizona, you live in a state that doesn't have SDI, then it's 60%. It only covers off-the-job injuries, not on the job, and it covers maternity, just like an illness. It covers you up to 3 months. So let's say you're out of work for 4 months because you're hurt or you're sick, then this would only cover 3 months worth. It has a 7-day elimination period, and what that means is that there's no payments for the first 7 days. So if you miss like 3 days because you have a bad cold, then you wouldn't get any money. You have to be out for at least 7 days. So on the 8th day, the payments start. Okay? How much does disability cost? Well, I'm going to ask you all to do a little bit of math, and it depends on how much the monthly benefit it is. So as you can see there's a mathematical equation that you have to do. So look at the bottom there. For example, if you are a 35-year-old employee and you want a $1,000 monthly benefit, then you just have to take that math times 1,000, and then as you can see, it's $20.64 a month, twice a month. That's per paycheck. So it just takes a little bit of math. If you need some help with that to try to figure it out, please don't hesitate to reach out to me and I can help you out. All right. Now, how do you enroll? So here's where I need your help. Because we're doing this over the internet, I'm going to need a little bit of effort on your part. If you could just fill out that employee information sheet and send it to me, or you could send it to your HR if you wish. I'm going to send back an application that has been preloaded with all of your information. I'm also going to send you a deduction authorization. I need those back no later than March 23rd, so that's coming up. I will also send you a form that tells you exactly how to file a claim, and also attach the brochures for the specific plan that you enrolled in. So please do not hesitate to call me or email me for any questions. I'm happy to help. Here is my contact information. I appreciate you taking part of this video. If you have any questions, give me a call.